Come in.
Hi, my name is Michael Argren. I'm a student from Nevada State College, and I'm here to check the patency of your central line, and also to change your dressing. Okay?
Okay.
Can you please say your name and date of birth for me, please?
Jennifer Hunt, 10/31/74.
All right. Thank you. How are you today?
I'm good. How are you?
Good. So make sure that you check the vital signs to get the baseline and everything. Make sure that measure the arm and measure the tooth. Just make sure that everything is good after you check for patency and change the dressing and check for edema. Somehow making this hard. Alright, Miss Jane. Are you allergic to anything? Or?
No.
Okay, good. I'm just using the clean gloves right now to take the dressing off. Alright, Miss Jenny, if you can just put this on me so to prevent any contamination on the central line, okay?
Okay. So I'm going to take this off. Make sure that you document every abnormal findings. And do it slowly so you don't pull the tube.
So first thing I'm going to do is I'm going to perform my hygiene, get my PPE on, so I'm on my gown, my gloves, and my mask. I'm going to open up, have all my materials here, my flush, my
No, I can just close this and
open up my away from me.
take this off.
Make sure I don't touch anything, make sure it doesn't touch the sides. And then they make these in try to keep that so sterile. Put my mask on here.
Oh, bigger one.
No, I can put my sterile gloves on.
Put the
And I can put this on. If you can just lift up your big line for me, please.
Just toss that, and I'm going to put my sterile gloves.
Thank you. And this can go here. So now using, so this is going to, I don't have to clean this area. So
So using this is gonna be my non-dominant hand and this is my non-sterile hand. But first I'm gonna have to open this. Through this.
Alright,
You can use hydrocortisone or betadine according to your hospital policy, but I'm gonna use the alcohol swab stick for this. So using my non-dominant hand, I'm gonna lift the big line up, and a clean circular motion.
inside the kit here. Grab my swab.
Make sure you do it from center to out, center out. Make sure they clean everything good. And if you have extra alcohol swab stick, you can go ahead and clean this area, just one side, and use another one, another clean alcohol swab, and clean this side also, just to make sure there's no any contamination and no dirt on the patient's line. So after that, you can go ahead and remove that, and using my sterile hand, I'm gonna go grab the gauze and put this on my patient. So just go insert it like this. Make sure that you're not contaminating the area. And you can go ahead and use that. Alright. And after that, you can go ahead and get your Tetraderm and put this on your patient.
I'm going to grab
So now you can use both hands because the sterile procedure for this part is good. Make sure that you secure your patient. And before you do this, make sure that you put your initial, the date, and the size of the gauze of the patient's line. So I'm gonna document it. Just use your initial, the date today,
I don't need to sterile, I will.
and the gun. So after that, you can go ahead and put this on your patient. You can take this off.
And now, since you don't need to be sterile anymore, just grab the sticker.
So you just take this off like this.
Okay.
Make sure that you're not putting the Tetraderm on your patient's nipple. Just make sure. And make sure that everything is good.
I will. Okay. So I'll just use.
So once everything's good and everything's in order, make sure that then you can put your label here. So after that, so initially document everything on the patient's chart and make sure that you have it. And after that, you can go ahead and flush try to flush the patient's line to check for pathogens. Make sure you have a 10 ml. You have a 10 ml syringe with 10 ml normal saline in it to flush the patient. To flush the tube. But first, you should do is use the alcohol swabs before you flush it. Make sure that you clean the IV for 30 seconds, 1 to 30 seconds. And after that, you can go ahead and connect this. First, you add 1 ml of normal saline first you unclamp this, and add 1 ml of normal saline. After you add 1 ml of normal saline, you can go ahead and aspirate 1 ml of blood to make sure that there's a patency. And once you aspirate it and you see blood in the syringe, that means it's good. And you can go ahead and insert the normal saline to flush the patient. Make sure you check for any check over here for any edema or any occlusion or any complications in the IV tubing or the PICC line or the central line. And after that, once you have a 1 ml left, to avoid any bubbles or negative pressure, you clamp this to maintain positive pressure once you take the syringe out. And once that's good, you can go ahead and attach this to your patient, clamp it to, make sure it's all clamped, and go ahead and clean your area, assess your patient, check for any complications, check the vital signs, respiratory, everything. And after that, you can also document everything on your file. And that's it. Thank you. After changing the dressing, make sure you add your documentation. Make sure you add the assessment of insertion site, external catheter length, the status of insertion site, what's the condition of the previous dressing, site care performed, adherence to sterile technique, the type of dressing applied, and make sure you label the site with the date, time, and your initial. Make sure you add the patency of the tubing also. That's it. Thank you.